Shin splints. So shin splints is something we see an awful lot at pure physio. I'm sure many physios do see them. It relates to pain or discomfort in the lower leg, the shin area. So down typically the front, or sometimes the back of the medial aspect of the back, anterior, lateral aspect of the front, so the side front area, or around the back of the shin. There's lots of different potential causes of shin splints and lots of different diagnoses within the title that is shin splints. In my experience, the most common is an issue with the tibialis anterior and tibialis posterior muscles, which sits, tibialis anterior sits at the front here, between the fibula and the tibia. Tibialis posterior sits at the back of the tibia. Now, we frequently see patients presenting with shin splints who have increased their physical activity quite rapidly from perhaps a low base, or perhaps were at a high base anyway and increased it to another even higher base. We also see it frequently in patients that have started playing racket sports or have had a period off playing racket sports and gone back to it. So badminton, tennis, squash, where you're having to rapidly move, lift a foot regularly. So the tibialis anterior, the muscle at the front here, is involved in lifting the front of the foot up. So it attaches in a way which allows, as you go to walk forward, you've got the calf muscle at the back, which is the power muscle that pushes you off. And then as you lift the foot to stop you tripping over, the muscles that lift it up at the front is typically the tibialis anterior, which sits at the front here and lifts the foot. Now, tibialis anterior and posterior and all the other small muscles that work around the foot and ankle sit within a sheath, like a bag of what we call fascia. Now, this is to prevent them swelling up and ballooning up, because gravity would take the blood down to them. So they sit within these bags. When you get shin splints, what frequently happens is the muscle is doing more activity. Say, for example, let's take the person that hasn't run before and is starting to do running and goes quite quickly, progresses too quickly. Rather than using like the couch to 5k type approach, they're going straight into 5 or even 10k's, not really to be advised in most cases. So in this case, the muscle's demanding more oxygen. You're making it work hard, it's demanding more oxygen. It therefore swells because it's opening or dilating the blood vessels, open the blood vessels to get that fresh oxygenated blood into the muscle. Bearing in mind the muscle is held within this tight bag of fascia. If the muscle keeps swelling, it can only go so far before it becomes restricted by the fascial bag. At that point, the muscle's still working hard, you're still making it work, running, etc. It's demanding more oxygen in order to stay functioning. You're burning that oxygen to metabolize. If fresh oxygenated blood can't get into that, what is now pressurized bag of fluid, fascia, the muscle itself starts to struggle, and it starts to have what we call acute pain, or pain due to lack of blood supply, lack of oxygen. That's when you get the pain, the cramping sensation, the burning sensation, whether it's the front of the shin or the back. At that point, you typically get to the stage where you can't do activity anymore. And this is often what people describe as shin splints. Now, one of the easiest ways to address that is relative rest. So taking it easier, not pressing so hard, working just prior to that point of discomfort and building up over weeks, in some cases months, to allow the fascial bag to expand at the same rate as the muscle demands that oxygen and therefore swells. There's other potential diagnoses that are linked to shin splints, and there's other elements within shin splints that are slightly more complex. The relationship between the muscle at the front and the muscle at the back, and some torsion elements with biomechanics. The first thing I'd say, if you have shin splints, certainly take it a bit steady for a while, see if that settles down. If it's not settling down, or you want further advice, just go and see a physiotherapist, get a good assessment, get a clear diagnosis as to what element is causing the shin splints and how they can be addressed. In the vast majority of cases, they can be improved quite rapidly with good conservative management.